Welcome back to the Patient First podcast. I am excited about this topic because it gets to the core of some of my mistakes, some of my whiffs, some of my problems, and so I'm going to vent them to you today. I recently did this webinar, which was great, called Winning the Second Half of Your Dental Career, because I've made some mistakes in my dental career, and there's some key ones that I think, some key things I did right, but there's also some key things that I've done wrong in the second half of my dental career. And I've got some feedback and interesting conversations coming out of that webinar that I did. So today I wanted to share 4 things that I wish I knew that I did differently before I sold my dental practices. Now, just for those of you who may not listen to the podcast before, about 3.5 years ago, I sold my practices to a large DSO and still own a fractional piece of the practice today. But it was a great decision, and I did a lot of things right. I think, I'm 49 years old right now, so I did the transaction when I was 46, and I could have retired, but I didn't want to. I'm still doing this. I love talking with dentists. I love training people and helping other dentists be massively productive by putting the patient first. But I think I hit a career goal that I think a lot of people would have wanted to earlier. But there were some things that I wish I would have known. And number one, the first thing I want to acknowledge is the gravity of this topic. I understand it's a big deal. And, I really didn't realize myself how big of a deal it is until I started talking to some dentists who are towards the end of their career and not being able to retire. I think there's a number of dentists that are starting to feel like they might never be able to retire. And it's overwhelming to me. I can't imagine being in that position, frankly, because, like I said, I wanted to be in the position to be able to retire by the time I turned 50. And I did when I was 46. And it's only been, frankly, better since then. But, there are great practitioners out there who I fully recognize have in some cases put 30 or more years into your practice, where you're doing quality work, where you're doing your best for your team members, for your patients every single day, and you're in the last part of your career and you can't retire. And I think that is just, I think it's philosophically wrong. There's people that say that they're stuck and they literally have seen the area around their practice. In one case, a dentist that the physical location where he is has changed, degraded so much. When he moved there to this area, built his practice, it was a thriving area. And now it's a horrible, it's lots of crime. The area around his practice has degraded, and he feels it's too late to move or to do anything to change. And, I think that's a tough position to be in. So, as I mentioned, my story is not a sad one like that. I built my practices to 5 general dentists, an oral surgeon, an orthodontist, and I did a lot of things right along the way. But I was able to retire at a relatively young age. And I'm going to go through on another podcast sort of the things that I think led to me being able to, the key things that I think I did that led me to be able to retire at the age of 46. I say because I'm not retired, right? But I had financial independence at the age of 46 because of the things that I did that I'll talk about in another podcast. But today we're focused on what I did wrong, because it's probably more fun to hear things that I did wrong, because that's, the best way to learn, I believe, is to fail. And here's some of my failures that I can pass along. So hopefully you can learn from them. Number 1, and again, keep in mind, I said it 3 times, I think now, I sold my practices at the age of 46. And I wish I had done it earlier. Okay, let me repeat that. I wish I had done it earlier. Once I sold my practices and focused on the other businesses that I'm part of, I've been much more successful than those years leading up to when I sold my practice. So I had another exit 2 years from a tech company, Opera DDS, that I founded. And had I started 5 years earlier, had I looked at exiting my practices 5 years earlier, there's no doubt in my mind that I would have had both those transactions be additive to about the same amount, and I would have had 5 years less prior to retirement. So I think it's common for a lot of dentists to just work, and not think about retiring until it's too late. And that includes me for somebody that sold their practices at the age of 46. So it is not too early to plan your exit strategy. If you are in dental school right now, planning how you're going to exit the profession, I think is important. With my technology company, I did that from inception. I knew exactly where I wanted it to be when I sold it, and I did that. And it took me a couple years after I sold my practices to hit those goals. If I had started my dental practice career with that insight, it would have taken me far less time. And if today you're a 68-year-old dentist and you have 3 years before you want to retire, it is not too late. But if you wait through 3 years, you're not going to probably be able to retire in 3 years. So the best time to start, as is often said, is today, right? I talk to dentists all the time in their late 50s or 60s, and they're starting to plan for their retirement, and it's not too late. The time it's too late is tomorrow. The better time would be yesterday, but that is not possible. So today is the best day, and you can still hit your financial goals, but it requires focus. Like, you have to plan it out, because without a plan, you probably won't be able to hit it. So, you can still plan your retirement, even if you want to continue doing dentistry, right? Here I am talking in a podcast about dentistry, and I don't need to be, because I don't want to sit at home or play golf. I love working. I just wanted to hit my financial goals earlier. And by the way, you could just find, for you, it might be you sell your practice and you want to focus just on doing quality care and have everything else taken care around you, including your financial independence. And you definitely can do that. It doesn't mean you have to stop practicing dentistry. It just means that you can exit your practice, and whatever that means, even if you are an associate, so you can have financial independence once you hit that goal. And so planning that piece out earlier is always better. So get started today if you haven't already. Number 2, the big question today is ownership versus not ownership, right? And what I mean is, I did own my practices. When I sold them, I sold the majority, but not 100%. And fractional ownership today is much more desirable, I think, than ever before. So as part of your thinking of an exit strategy, if you are a practice owner, do you want to sell everything or retain a portion? And I didn't think about this, frankly. It was more, I was looking to have an exit, and I didn't put enough thought into how much of the practice do I want to retain. Now, I think it worked out fairly well, but there's, I retained a fairly good size of my practice, which has upsides and downsides. And if I could rewind the clock, I probably put not enough time into that decision to really think how much of the practice do I want to own on the back end. But, this is not often a financial decision. So for me, it was not a financial decision if I sold X amount or more or less. So I didn't sell the highest percentage of my practice because financially I didn't have to. So I'm like, I'll just retain a relatively good sized chunk. But the question is, how confident are you in the people that are now going to be the majority owner, that they're going to do what you want with your practice? And will they do a better job than you did so that the practice will go up in value? Chances are probably yes, or maybe not. That's just something to be more intentful than I was about thinking. So think of your practice as if it were being listed on the stock exchange, right? And let's say you own 100 shares of Apple stock, and you are thinking, well, I want to retain some of that value back. Do I want to sell 100 shares? Do I want to sell 90 shares, 50 shares? You can make that decision. And it's not just a financial decision. It's how much do you want to retain equity in this company, or would you rather put it on the stock market? Because if you think it would be better off in the stock market, do that, right? I mean, you can invest in Apple, Tesla, Ford, whatever stock you love, or Disney, or a REIT. You can buy a building. You can invest in anything. So when you're looking to exit today, you can retain a piece, and I think that can work really well, or even buy a piece. You don't need to own 100% of a practice to get a financial benefit on it or to have some control. There's a lot of factors to think about, but one of the factors that I didn't think about enough, I think, was how much do I want to retain? So it's a personal decision. There's a lot of detail that goes into it. And frankly, I don't think it's necessarily 100% a financial one. Will get down to how much do you want to be involved or not involved, how much you want to guide the practice, how much you not want to guide the practice. It's a big deal that I didn't think enough about. Number 3, it's the people in your practice, right? I learned going through this transaction how challenging it can be for the people that are left in the practice, even if everything else is better, because any transaction is going to come with one thing: change, right? And even up for a team like mine that thrived on change, this is a biggie. And so in my case, I had a phenomenal team in place, and in particular, great clinicians. So I knew that no matter what happened, the clinical care that my patients received was not going to suffer at all, right? Frankly, if I started winding down, which I did, and not see patients anymore, which I still see patients, not nearly as much as I used to. I don't see scheduled patients anymore. But it was paramount to me that the patients that I've seen for years have received the greatest clinical care that's available. Because, obviously, do a podcast called the Patient First Podcast, and I believe strongly that we have to put the patients first. And number one in that is having the best quality care that we could provide. And I definitely achieved that. So I did make sure that we had great clinicians, great people doing great dentistry in the practice. And I feel very strongly that we achieved that, and we have a great team today. However, I wish I would have let the people know sooner that we were going to have a transaction, which sometimes is very difficult, particularly if you don't know if a transaction is going to go through, or if you don't know how much in my case, it happened very fast. I wasn't really looking to sell my practices. I just found a great fit for me and what I was looking to accomplish. And so there wasn't a lot of time. But I think letting people know as soon as possible, in my case, maybe in yours, which is anxiety producing, letting your team know that this transaction's coming, letting them know sooner rather than later, I think is a good idea. So that's number 3, really focusing on the people. In my case, the mistake I made was not letting people know soon enough, I believe. And it was really a reflection of how fast things went down. And number 4 is probably what most of you are kind of wanting to have guidance on, I think, is the actual transaction itself. And this is a big, big, big deal that I can't overstate. It's that the devil is in the details. It's a cliche, like a lot of cliches, cliche for a reason, right? There's a lot of details in these on the documentation, in the legal aspects, to not gloss over. So work with great advisors. We have accountants on this podcast. We've probably had attorneys. I don't remember. If you need somebody, reach out to me. Like, subscribe, comment. If you're one, leave your name, because working with great advisors that can catch the details are important. One person I talked to said you can back into any valuation. So if you think your practice is worth $100 million, great. We can get to that number if you hit these goals, right? If you hit these goals can be a billion details that will never, ever happen. So some examples that I think warrant taking a look at very carefully are non-competes. And again, these are mistakes that I have made. And so you can infer that I would wish I would have looked at these details more closely. Non-competes. You might have opportunities in the future that pop up that you don't even think about today. So, a non-compete should not be too broad or too big or too long. So, you might want, let's say you sell your practice, and just for sake of argument, they don't want you to practice within 25 miles of this practice ever again. Well, ever again isn't going to be enforceable. So maybe they say 10 years. Well, are you sure you're not going to want to practice in that neighborhood again? Reduce it down to 3 years or 5 years or whatever. It's a negotiation point, and that detail may become very important in a couple of years. So non-competes are something to take seriously if you're exiting your practice, because you might want to go back. You never know. Number 2, be careful of anything that binds you to the transaction, right? So on the back end, particularly this is if you're, going to have a couple years after where you're working in the practice, those details of what's going to happen after the transaction are incredibly important. It isn't just about the valuation. It isn't just about the percentage you're going to sell. It's about what are you going to be tied to on the back end. In particular, something like an earnout. If you're ensuring that the practice is going to be hit a level of profitability for you to get another chunk of money basically for the practice, and you don't have control, how confident can you be that you'll be able to hit that earnout, right? It's been my experience, and I've talked to other people where when you are not in control, it is much more harder to hit an earnout sometimes than if you have control, frankly. So be careful of those, and just food for thought that the devil is in the details. So hopefully that was helpful. That's some of the things that I wish I had thought more about going into my exit from my practices. I'm still, again, it was a great experience, great leadership and people at the organization that bought my practice. And I think it's a wonderful, wonderful thing that everything went very well from my perspective. However, I just want to provide some insight into what I think I wish I would have been thinking more about as I went through that process. So thank you very much. Hopefully this has been helpful. If so, please comment, and subscribe, and to see more podcasts. And we're actually building it all out now on upgradedental.com. So you don't even have to watch any ads. You don't have to go to YouTube. You can go to upgradedental.com to watch these podcasts and get a lot more. Not just me. We have 6 faculty members that are coming on board where their podcasts will be there. It's really going to be a hub for how to grow your practice, including all the information you need to know, courses, events that we throw, which are awesome, that will only be available at upgradedental.com. So look forward to seeing you there. And I look forward to seeing you next week on the Patient First Podcast.